Good afternoon, everybody. I would like to call to order the Cabarrus County Board of Commissioners work session for August the 4th, 2014. For those of you in the audience, if you have a cell phone or mobile device, if you would please make sure it's on silent or vibrate, we would appreciate that so that it doesn't go off during the meeting. And Commissioners, first thing we have is approval of the work session agenda. So do I have a motion to approve the agenda?
So moved. Second.
We have a motion and a second. All those in favor say aye.
Madam Chairman,
Yes, sir.
I had one bit of discussion on that. I wanted to make a motion to bring back something that we had tabled a little while back. Would you like me to make that now, or would you like me to make that?
Yeah, we need to put it in the agenda,
Okay.
in
It would
the
technically
agenda.
be for the work or the meeting agenda, but we had tabled our effort to make our parks ordinance consistent with the state law regarding firearms. It's back in the fall, really, and I don't believe that we ever took that issue back up again, and we had tabled that, I believe, at an actual meeting, not a work session. So we went through all the work session work, so I think it could go on the actual agenda for the meeting, but I just wanted to make sure that I had given you plenty of notice about it.
Let's put it at 4.11 for today, and then when we do the agenda for the regular meeting, then we can slide it in there. Is that okay? And I remember that discussion, but if we'll just kind of do a reminder, and Londa hasn't had a chance to prepare, but in case there's any questions for her between now and then, she'd have an opportunity to hear any comments. Is that good for you? Okay. So I'm going to put Parks Ordinance to make it easy. Okay, so let's go back, and Steve, you made the motion to approve the agenda. Will you amend your motion with the addition?
Yes, ma'am.
And you'll second still? Okay, so we have a motion second. All those in favor say aye. Aye. Okay, great, thank you. Okay, the first thing that we have, Anion is here from Cardinal Innovations. And as we all know, just for an introduction while you're being seated, that we do get a dashboard report for mental health, intellectual and developmental disabilities and substance abuse services that Cardinal Innovations handles for Cabarrus County. And so you're here to give us our report.
Yes.
Welcome, and glad that you're here.
Thank you. Good afternoon. This is the fiscal year 2013-2014 report for all county, state, and Medicaid dollars that have been used for individuals in Cabarrus County for mental health, intellectual developmental disabilities, and substance addiction. So we'll just go through the report. At the top is your county dollars and how those dollars are used. Those are used specifically for crisis services within the county, your crisis recovery center, mobile crisis, which is a team of licensed therapists that actually go out into the community to assess, to try and divert emergency department use, as well as medication assistance. This is for individuals that are uninsured, not eligible for Medicaid or insurance, as well as for indigent meds, and this is for some of the providers within our community, for individuals that do not have the funds to cover their medication cost. This is just a count of the number of consumers served, both by Medicaid and state. I would caution for June, why that number goes down is we have a 90-day claims reporting, so providers have up to 90 days to report. So that number is always lower at the last component, but that will go up. Innovations is essentially a long-term service, but it is an alternative for individuals with intellectual and developmental disabilities that are at risk of being placed in an institution. The state, over the past year, did allocate additional Medicaid dollars to serve more. So you'll notice from March and then into April and May, those numbers went down because those are more people being served in the community as an alternative to an institutional placement. Residential, our Registry of Unmet Needs. This is for individuals with intellectual and developmental disabilities, adults, looking for residential settings in the community, essentially what we may call group homes. That number doesn't necessarily mean that the need is unmet. It could be that an individual's waiting for a particular home that doesn't have availability, and they can stay on that list until that's open. For adult day vocational programming, which we call ADVP, here is known as your vocational workshop, your Cabarrus vocational workshop here in Cabarrus County. And as for individuals waiting, this is a state-funded specifically service. Now that number has gone down slightly. Due to the provider, there may have been an individual that has moved on into a different type of service, so had some openings, so they were able to serve some, but that number tends to stay consistent because state dollars have not increased. This is just a breakdown of different service categories of how many individuals have been served in the past year in Cabarrus County. For each of these categories, the end of the report does provide definitions for each of those. For outpatient, you'll notice those are the individuals that are served the most. Simply that is mental health, substance addiction, those tend to be short-term services. So you'll see more people served in those numbers. I would point out as well for innovations, if you see how that number is very small. But as we move to the second chart, in your claims, innovations is the highest paid out service. And that is because it's a long-term service. It's for individuals with highest needs that are at risk for institutionalization. So those numbers tend to be much higher. For your crisis services in Cabarrus County, this is a comparison of Medicaid and state dollars for your facility-based crisis and the mobile crisis. This does give a comparison from 2012, 2013 to 2013 and 2014. If you can also see for a crisis recovery center, the state dollars are much more significant because many of the individuals that need this service are not eligible for Medicaid. As well as a comparison of consumers served. And this is Medicaid and state funding for your facility-based crisis as well as your mobile crisis. Innovations, this is a comparison for fiscal year 2012, 2013, and 2013, 2014 of numbers served, as well as the graph below are the cost of those services. Those service dollars have gone up somewhat, and that's simply because we're serving more people. This is a breakdown of the top 10 providers within Cabarrus County, how many people they've served, as well as the top paid claims. The differences as why you don't see the same providers is the majority of the top paid claims are for providers that serve mostly intellectual and developmental disabilities through the innovations waiver. Because it's long-term, it's a higher cost. These are the two providers specifically in Cabarrus County that have served the highest, and that is Daymark Recovery Services. It's just a distinct consumer served per month, as well as for Northeast, as well as their outpatient. So this is for the hospital as well as outpatient. I will note a discrepancy in this graph for after December for Northeast, where it says 0. That is inaccurate. Northeast changed their name, and so in our reporting, the system didn't pick that up. So those numbers, they didn't just drop all those people off. They're still there, and I am working on getting that report corrected and can get that to you. Okay. And just definitions of the different areas in the report. Any questions?
Commissioners, anybody have any questions? And again, this is a requirement that you come and make a presentation to us to show how the funds are being used and what services are being offered.
Exactly, and how vital those county dollars are to, particularly for those that do not have Medicaid and are unable to get insurance anywhere else.
I have one question for you.
Sure.
You had talked about a few different groups of people, and you said some of them are indigent but ineligible for Medicaid, I believe, and Medicare, and I was curious what the reason was that they were ineligible for those things.
So typically, for instance, we'll take like substance addiction, and this is not everyone, but could be maybe a young male, single, is not eligible for any other type of assistance and unable to get insurance. The homeless, unable to get benefits. Sometimes you're able to link them to benefits once you get them in. But for others, if they're just looking for, if they come in and they need medication, maybe for a psychiatric condition, those are provides assistance for them to start getting on medication while we look for benefits for that individual. Sure.
And do you guys have a way to, you say that they came in and they don't have insurance or they're underinsured. How do you, is there a means test on your end, or how do you guys determine if an individual is able to receive your services?
For crisis services, anyone can receive that, and that is through our network of providers. Now, our providers are responsible for looking to see if they're eligible for any type of assistance because dollars are so limited. But at that point, if they are in need of a crisis service,
It's just, yeah.
they come in.
Yeah, okay.
And so we do keep county and state dollars, most of those a priority as crisis.
Okay, and then let me ask you on page 8, the most recent year, consistently each month there's an increase in number served and then also the cost of service. What do you attribute that for increase in number served?
For innovations, we were able to receive additional funding this past year from the state. Now, that is Medicaid dollars.
Right.
But from that, so as people are added on to the waiver and they start using those services, those numbers are going up, including the cost. But it is basically because we're serving more.
Okay, so before you had the increase in Medicaid dollars, where were those individuals being served, or were they just not being served, or?
We do have, and it is located on your pie graph, there is a service, what we call B3. And this is, if we have savings through a year, and that is being able to utilize those dollars in a very managed way, where we're still serving more, we can use those dollars to add new services. So if an individual is waiting for a service, we may be able to provide something like respite to the family, where it's some funding where maybe they get a break every weekend or a few days a week while they're waiting for that service. Some choose not or may not be eligible for Medicaid, and so they may have to wait for those services.
Hey, any other questions? Anna, thank you so much for
All right.
coming and presenting this every year.
Thank you.
Okay, Commissioners, the next thing we have is 4.1. Mike, you're going to talk about that?
Yeah, this clean up the here. The Council on Sustainable Local Economy, the last time they met was December. If you remember, all but one member resigned from that committee. So what we're doing is having you, by resolution, dissolve that committee or that council.
Okay, Commissioners, any questions on this item?
Mike, did we receive any objection to this committee being dissolved? I'm sorry.
I have not heard of any. Megan, have you heard anything from the public based on it? No, sir.
Okay. Next item, county legislative goals.
Yeah, real quick, as we do every year, or as the board does every year, submits a list of goals of interest to pass on to the Association of County Commissioners to consider and vet through their goals committee in an effort to create a concerted list of goals to submit to the legislature. You have a list, or actually you have the packet that is sent to the county for your review on how to go about doing this, what is the schedule, and then ultimately, once they're submitted by, I believe, September 19th, it will go into committees of the association and then ultimately come to the conference in January for delegates from every county to come in and consider, hear the votes, or debate the goals, and then ultimately create the final project that goes on to the legislature. So we have 2 months in order to get these back prior to the deadline. We wanted to get this in front of you so that you would have the information to review the list of goals that you currently have. Some are moving forward. Some have already been based on statutes or based on the activity of the legislature over the last year. Some are being addressed. Just look at the list that you have now. Pass on some others that you would like for us to include, some other ideas that you would like for us to research for you and get back to you so that you can discuss either at the regular meeting or at the next work session. And then ultimately, if you don't do it at the next regular meeting, we would ask that you definitely do it by the September regular meeting so that we can get it submitted in time to meet the association's deadline. So if you have any questions on the process, we can try to answer. Last year, or 2 years, this is a 2-year process. Well, they do goals every year. However, the association only votes on them on a biennial process. So this coming January is the next time that they do vote. So I think that's about it. So please read through what we have. If there's some things of interest to you individually or the board collectively, please let us know as staff and we can do the research for you and get it back to you as quickly as possible so that you can consider them.
Do you have any questions about these tonight? Okay, those are on page 32 and 33 of our agenda, so if everybody will just look at that, and like Mike said, you can email him if you've got something that you want to add, or if there's anything that you want to take off, and then we can talk about it at the next meeting, or we can wait and put it on at the work session if you don't want to, if we don't need to talk about it at our regular meeting. So you can think about that between now and when we.
The only thing that I would like to add is we had, I think, passed unanimously the resolution regarding, I can't remember specifically, so if it wasn't unanimous, pardon me, but regarding the food stamps and the expense with respect to that, I think we had talked about getting it onto this list, and I would like to see that go on the list.
Okay.
And if you think of anything else, then of course send that over our way. Okay. The next item, the signer on the bank account, we are requested to suspend our rules tonight and to go ahead and change and make Susan Farrington as the official staff signature on that bank account. Pam, do you need anything you need to add?
Just to point out that on July 25th that Ms. Wilson has transferred from the Finance Department to Human Services, and Ms. Farrington has been named the interim finance director, and this is our main bank account, and needed to get the authorized signature changed over as soon as possible so that we could continue the pre-audit certification portion of this along with the bond that goes with it. So that's why we're asking for suspension, and the bank has requested that a letter be signed by the chairman of the board indicating that the board is aware of this change.
Okay. Anybody have any questions or comments? If not, may I have a motion to suspend our rules? I have a motion. Do I have a second?
Second.
Motion second. All those in favor say aye. Aye. Any opposed? Okay, may I have a motion to approve the change that Susan Farrington be the official staff signature on the SunTrust bank accounts? I have a motion and a second. All those in favor say aye. Aye. Any opposed? Okay, great. That's an easy one. Okay, next we have general fund. Larry, you tabled this from our regular meeting. um,
Table it again, we don't have anything else about the school board.
I haven't seen any information, so do you want to put it
Can we
at
table it
the
till September?
September work session?
Yeah,
Sure, you just have to make the motion.
that's what I'd recommend we do.
Anybody else have a thought or comment on that? Everybody good with that? Okay, let's see, I guess we need to suspend the rules and make a motion to table it again then, since we had tabled it to today, or
Well,
what
if
do we
you're
need to
just
do?
gonna- If you're just going to consider it again at your regular meeting, you would just do that at the end of.
Well, he wants to move it to the work session in
to-
September.
Oh, I'm sorry.
So can we
Um,
just not put it on the agenda when we approve the agenda for the regular meeting, and
That's
then it
fine.
would automatically carry over?
We can table it at the regular meeting, can't we?
Yeah, well, you had
Yeah.
tabled it to today, so
Yeah.
I just want to make sure. Megan, what'd you say?
You just table it when you approve your regular meeting
Yeah,
agenda.
so when
Yeah.
we approve the regular meeting agenda, that's what I was getting at.
That's what I would suggest.
That's what we'll do. We'll
Okay.
table it at that time. Is that okay with everybody?
Well, my only concern about that, Chairman, is I believe there was a article in the newspaper today that we would be discussing this, and so I think the longer that we leave it on the agenda, the more likely it is that somebody thinks we're going to discuss it. So if we're not going to discuss it, I'd just prefer to make a motion to suspend our rules and go ahead and table it till September if that's what we're going to do.
Well, and that's what they were saying. If
Okay.
we'll just, when we approve the agenda, we'll just pull it off when we make that motion for the agenda. We'll probably be easier on typing up the minutes, because we have the next one too, that I presume will be the same. I don't know, but we'll go to 4.5 then. Larry, you tabled that one also. You want to do the same thing?
Yes.
Okay. And I think it's just a matter of trying to get the information. If I understand correctly, when the meeting started, I think Rich has gotten some information, but I haven't seen any of it. I don't think staff has even had a chance. She just got it today, because Pam was on vacation and it's.
That's correct. It's
Okay,
about-
that thick.
It was delivered to my office late Thursday afternoon, and so I brought it up to the county today for review, but Mr. Bois was on vacation last week, and then I was out Friday, so that's kind of the status of the receipt of the information.
Okay. Next, we have 4.6, reappropriation of funds for ongoing projects. Susan, you going to come up for that one?
Your agenda packet, there was a list of reappropriation items carried forward from our 2014 budget to the 2015. Some of these projects are things that just could not be completed by June 30th. Other things are grant-related. This is our first run of our reappropriations, so I will come to you again in September with another list. We just closed out our books on Friday, and we're having final numbers still coming in, different bills that have not been paid. Revenues are still coming in, so like I said, again, in September, I'll have another list for you. But before we use the list, I didn't know if you had any questions about particular items on the list. There's a budget amendment and a particular list. I do want to point out one thing. There was a request for the school roofing project. That one is on the second page, and it's for $193,000. We did receive a late bill last week from the schools where the money, part of the project had been done by June 30th, so I'm not going to reappropriate that money. It will be paid out of the 2014 books. So that amount will go down to $59,000. I will make the correction and have the correction in the agenda packet for the August 18th meeting. So that will be one change we found out about last week. That was for the Royal Oaks roof replacement.
Mike, is there anything you want to add?
Any questions?
Okay. Does anybody have any questions about this list tonight, anything in specific?
Susan, I have one question for you. On line item, it's 1633206901. It says fund balance appropriation.
Sorry, Jason, which page are you on?
I'm on page 51. That is $2.255 million. Is that, I can't do the math. It looks like it's pretty close to being a collection of the line items just underneath it, just consolidated onto one line. Is that what that is? Okay.
We do the fund balance appropriated by department. So for that particular department, the $2.2 million for the 3320 department.
Thank
All those
you.
added together, that's how that works.
Any other questions for tonight? Okay, so we'll get out that updated one
Yes.
before our regular meeting for us to take action. Okay. Okay, next, 4.7, Community Transportation Service Plan Resolution.
Good afternoon. We are glad to be here to present to you our resolution for engaging with the state to do our 5-year plan for transportation that we do every 5 years. And this is the community transportation service plan. And basically, the goal of this plan is to take a look at where we're going in the future with transportation services, look at building efficiencies, and look at unmet needs and other areas that we'll be having. And this is, it's time for us to enter that plan. Bob's going to tell you a little bit more about it, and we have James here as well from the state if you have any questions that are above our head. But I'll let Bob give you kind of a brief synopsis of the purpose and goals of the 5-year plan.
This plan is a collaboration between the state and ourselves. It's about a 6 to 8 month process. It is geared specifically for Cabarrus County. They will look at many factors, our geography, our trips, how we conduct our service, to come up with some strategic goals, look for unmet needs, improve efficiency. It will involve input from the citizens of Cabarrus County, and there is a steering committee with many people in this room will be on the steering committee. So it's a joint effort between all involved to come up with the best possible plan for the future of Cabarrus County transportation.
And the resolution is the first step in that process, to basically just authorize us to engage with the state to start this process. The state covers 90% of the cost of doing the plan. We do cover 10% of the cost. We have that match budgeted in our budget that we put in last year, as we knew this was coming. And that's, so basically the resolution that you have attached is what we're seeking approval this month, and then we'll start to engage and go forward and bring back continuous reports to you as well as we go through the process. So we'll be happy to entertain any questions you have on this.
The steering committee that you mentioned, you said it'd be people in this room, or a lot of people from this room. How are those people picked to serve on this steering committee?
Well, basically, I've contacted everybody that I know, and senior services, parks, Department of Aging, other CK Ryder,
So are these
Rowan County.
Are these citizens or employees of the county? Or?
Well, they're both some tab board members, and there will be, if I'm not mistaken, James, there will be some public meetings where the citizens will have input.
Okay.
Steering committee is primarily stakeholders probably, and people that are involved directly or indirectly in that, and they help guide the process along with the state.
Okay.
Okay, any other questions? No? Okay, thank you.
Thank you.
Okay, 4.8, Jonathan Marshall. Emergency hydrants for Northeast Volunteer Fire Department.
This is an item that we had first brought before you in November of 2013. With the installation of the water line that will provide the part of the interbasin transfer and providing water to Concord and Kannapolis systems that will run down North Carolina 49, Northeast Volunteer Fire Department had requested the ability to install some emergency hydrants on that would only be used for the purpose of filling their tankers that are actively fighting a fire or have an emergency. The estimated cost per hydrant was $20,000. This board had, by consensus, agreed to 2 locations and a total of $40,000. We've continued to work on that, and when we were looking at the reappropriations, we realized we had not brought a budget amendment forth to you, so this is actually to bring that budget amendment to budget the $40,000 for this purpose. As I said, the water line, of course, is under construction now, so there has been no, we can't install those hydrants at this point. But in addition, Northeast Volunteer Fire Department, our Fire Marshal's office, and particularly the engineering department for the city of Concord have been working on some cost-saving ideas, because Northeast would like to see more than 2 locations if possible, as well as I think you may recall they talked about the need for a sprinkler system in their fire station itself, and look at the possibility of somehow providing that, because that would allow them to put dormitory space and then have 24-hour coverage out of that station. So with this budget amendment, we would continue to work on that. There's some other ideas being explored, one of which is that the contractor who's installing the water line would simply put in a T-valve so that these could be added after the fact by a different contractor if that could result in some savings.
Just for clarification, again, the original discussion was that the hydrants were going to be an estimated $20,000 apiece. You agreed that 2 were based on input from Mr. Marshall and Mr. Smith and Mr. Langer. Just one clarification: if you approve 40,000 tonight, if we can come in less than what those 20,000 are, and there's enough money in that 40,000 to cover for 3 hydrants, are you okay with that, or do you want us to come back to add that 3rd hydrant? You understand what I'm saying?
Wasn't 3 what they wanted?
The fire department would prefer 3. They have requested 3, but at the time, the cost of them and then some of the other logistical things that we were looking at, this board agreed to 2. But however, the costs sound like it's going to go down a little bit. We're not quite sure how much yet, but if we can get it down to, 12,000, 13,000, we can get it under that 40,000 and get 3 of them in at key intersections within the district. So
I would definitely be in favor of that. And also, I've heard some discussion about some issues regarding right-of-way acquisition for the fences that were going to be required. Is that still being worked on? Or?
Actually, the Concord and Kannapolis have agreed to remove the fencing requirements. Okay. That's one of the cost reductions. And then associated with that, it would reduce the need to buy additional right-of-way, because with just the hydrant, and it can be located on the edge of the right-of-way, DOT has agreed to that. So that helped us a great deal, both in terms of cost and location.
Well, I would certainly be in favor of getting more locations if we can.
They started, so I was just going down the line. You're good with that too? Jason, you're good with that? Okay, so that way you'll know.
Okay, great, okay. Thank you.
Okay, and Jonathan, you have the next one.
As of 38 minutes ago, we had not received an upset bid on the property on Union Street South that you authorized us to advertise for upset bids. So the bid of $6,000 from Bright Parson LLC is the high bid, and that upset period has closed. So that'll come before you at your regular meeting. If you choose then to accept that offer, we would ask that you authorize the county attorney and county manager to complete that transfer.
Are there any questions about this item? Okay, thank you. Okay, next, Veteran Services. Tim?
Madam Chairman. Commissioners, I'm here to discuss and bring up again the topic of Cabarrus County becoming a commemorative partner for the Vietnam 50th commemoration. This item was actually first discussed, I believe, back in December of 2013, but was kind of overcome by the issue of the park being renamed. I think it was on the original agenda for December 2013 work session. But I provided some background information on both the commemoration and the program itself. And basically what it is that just by doing a couple of forms that I can do, it doesn't cost any money, but Cabarrus County can become a commemorative partner for the commemoration that the Department of Defense is spearheading here. So Concord, City of Concord's already done it. A lot of counties in North Carolina have already signed up, and what it requires is that we just do 2 events a year between 2015 and 2017. And like I said, it takes 15 minutes to fill out the forms, and I'll do all that and everything, all the coordination. So I think it would be good because Cabarrus County does support all the veterans, and with the Vietnam commemoration coming up, I think it would be a good idea that Cabarrus County step up and be a commemorative partner also.
Commissioners, any questions?
So are you also volunteering to spearhead the two events?
Sure, I'll be happy to do that. My office has already become, as the Veteran Services Department has already become a commemorative partner also. So we can work.
Does that mean you do two and
We can combine the two and make two total.
Yeah.
And I can, my department can represent the county's events also.
Great, thank you.
You're welcome.
Okay. Everybody good? I see heads nodding, so it looks good.
Thank you.
Park ordinance, do you want to just go over that briefly and let Londa know anything, or I don't know if you have any questions, Londa?
As we had discussed back in the fall, the state legislature had changed the state law prohibiting counties from completely prohibiting the carrying of firearms in park by concealed weapons holders. And so we had discussed that somewhat, and then it came to our meeting time, and I think Londa was going to be absent for that meeting, so we had tabled it, and with everything else going on, we had just never brought that back up. But I would like to see our ordinance be consistent with the state requirements. And really, there had been 2 United States Supreme Court cases, Heller and McDonald, that have expressly conferred upon individuals an individual right, which had not been happened before for the Second Amendment. And so, you know, I think this is a good opportunity to really look at it with respect to our parks, and then make sure that we're all in agreement with respect to what our ordinance is for the people's property and things like that. So, you know, we had gone right up to the meeting, and so I wanted to get that put back on so we can get consistent.
Okay. And I know you're aware of it, or well, so you good with that?
There is one additional part to the law that states it can be banned in 3 areas. That's athletic complexes, swimming pools, and recreation centers. And I think recreation center is defined as a basketball, Rich, you have to help me on this, as a basketball or active pursuit area. We did ask about the senior center, and that is not considered a recreation center, or under someone's interpretation. You know, everyone that you talk to about it has a different interpretation, regardless of whether it's an attorney or the people that interpret the laws. So, but that is an addition to, and the Board of Commissioners would have to have that put in our ordinance to prohibit it in those 3 areas, and then it would be allowed, guns would be allowed anywhere else.
So, Rich, you and Londa would need to work together to draft that for us?
Yes.
We had done that previously.
We had done some work on it,
of
yeah.
which the Park Commission brought the recommendation to this board that it be banned in those 3 areas, but and then the signage would reflect that. And that was another question that there had been all across North Carolina about where did you have to put the signs and how many signs did there have to be, location, number. I think all of that has been finalized. Actually, it says 1 sign will work, but I don't really see how that could ever come into play.
Right.
Do you think that you can have that for our regular meeting in 2 weeks, or would you rather have that for us at our next work session?
By the meeting on the 18th, don't you?
Yes.
Yeah. So there's already been quite a bit of work done on this. I think we were also thinking there might be some change made to that, because there was a lot of controversy about it. That's been a pretty hot topic for most years at the General Assembly, but this year, nothing. So I think the way it was last fall is pretty much the way it still is, as I understand it.
Originally, there were 4 areas of where you could not take, carry concealed weapon, but it's down to 3 now.
That's right.
That's the only difference that I know in the last year.
I think the question that I had at that time was whether or not our rules were consistent with the municipalities, having concern that citizens would not be sure whether they were in a city park or a county park. And I felt that it was important that it be consistent throughout. Do we have the municipalities all taken a position?
City of Concord had the council pass the ordinance banning it in the 3 areas. Actually, they banned it in 4. They did it quite a while ago and then had to go back and revisit when they changed it to 3. Kannapolis has, and Harrisburg was doing it in February, moved it to March, and I haven't talked to them since then as to whether they did, but I will check with them to see if they have passed it. Their recommendation to the town was the same, to limit it in those 3 areas.
Right. So if that passes and we pass that, it'll be the same
Everywhere,
everywhere.
yes.
I think that's important. Thank you.
Okay, so if you can just get that back to us at the regular meeting, is that okay?
Rich, will you let me know, I mean, clearly I understand that in the courthouse, firearms are prohibited by concealed carry holders and also at the detention center. Does our ordinance prohibit concealed carry on any other county property? That would be something that I would like to look at. So if you could get that for me in the next week or so, that would be great.
I can get the information and have it to Megan to distribute before then if you so desire.
Yeah, we want to get it out as soon as possible.
Thank you, that'd be great. And I should have, if I'd moved my paper when we adopted the agenda, I was going to add an item and I forgot because I had it underneath my paper. So I know we already have done the agenda. I would like for us to talk about school nurses either tonight or in 2 weeks. I don't know if you have a pleasure on that or if anybody wants to talk about it. So I would like for us to talk about it. And if I'd like to add it to, make a motion to add it to the agenda now. I should have done it at the beginning. I apologize, I just had it covered up. So is there a second to adding a conversation?
You want to add it to tonight's agenda
Yeah,
or?
it'd be better to add it tonight so I can just show you some numbers.
I'll second that motion.
Does anybody have a problem with talking about it tonight? I'm sorry, I meant to say it at the very beginning, I just forgot because it was underneath my papers. Okay, all those in favor say aye. Aye. Any opposed? Okay. Thank you, I appreciate that, I apologize, I should have. You've probably saw in the paper about the hours being reduced. I mean, there was an article, I think, in Sunday's paper, maybe. So I asked Pam which I can get this, or she can get this to all of you. She handed this to me when I got here tonight. What the shortfall is based on the hours that are proposed. I think it's 1 hour a day proposed to be cut, and it's $164,905. And you said that the Health Alliance agreed to that number, that's the number?
When we were reconciling the differences between what they had in their budget versus what we had in our budget, we reconciled all the merits, and that $164,000 is the 9 extra days plus the 1 hour per day, the combination that we proposed to fund last year, and we weren't given the right number to put into last year's budget, so that's the shortfall of what we would have funded last year to cover the 9 extra days plus the 1 extra hour, had we had the right numbers.
Okay.
And yes, Sue Yates reviewed that with me.
Okay, so they have acknowledged that that's the amount of money, $164,905. And school starts in 3 weeks. Staff goes back in 2, which means if we were to agree to add that funding for the school nurses, it benefits the schools. It benefits staff and students that are in all the schools. And personally, I think that we should come up with that amount of money so that they don't cut the hours. It was an oversight. Everybody makes mistakes sometime or another, and I think that's what it was. We had lengthy discussion, so I'd like to ask for your input if you'd be willing to provide the funding. We could add it to the agenda in 2 weeks for approval if everybody's willing to approve it. Or any questions that you have. You probably know about as much about it as I do. Most of my information is what I read in the newspaper article.
Madam Chairman, I would say I'm comfortable with the funding. I have 2 children. They go to a preschool, and they have 100 children run around there. And when they show up, there's no student nurse, or there's no school nurse there. I think there's a lot of people that send their children to private school around the county, and when they go there, there's no private nurse at that facility. In talking with some of the nurses, I think that the function of a school nurse has been drastically reduced because of liability and things like that in the last several decades, whereas, in the 50s and 60s, they probably provided a very integral portion of healthcare for young students. Now they are not allowed to do that. So there was one other point that I was going to make. I think that with a lot of the resources that we have at home, several people I know have the ability to, text their doctor or call their doctor or look at WebMD or look at a variety of resources that do fill in the gap of what the student nurse used to do. I'm comfortable with them being there for 90% of what they were there before.
Okay. So you do not support the extra funding? That's what
I'm comfortable with the funding that they have now.
Okay, that's what I missed what you were saying during that. So.
Is it the same funding they had last year?
No, I think we had an error last year, and between I couldn't tell you 100%. Well, no, is it? I'm sorry. Let me not answer a question that I don't know how to answer correctly. It's better on me to call and Pam.
When C. Yates and I went back and evaluated it, we found that when the information was given to us from the previous finance director, she picked up the wrong number on the form to compare to what the current funding was to what the new funding needed to be for the 9 days plus the extra hour, and that's where that shortfall came in. Also, there was no benefits that were attached to that money that was funded, and the 164 is the error of what was not picked up on the form. So had we done what we intended to do last year, we would have had that $164,000 in there, but
it wasn't in there last year.
no, it was not in there.
So, but they still operated last year. Where'd they get their $164,000 to fund it last year?
I don't know if it was
Not
from...
sure, unless it was a fund balance.
Apparently they funded it, they didn't cut hours.
Or portion of that one-time money.
Yeah, I think they used
Right.
the portion of that one-time money that we gave them.
Which the one-time funding, the money was supposed to cover the shortfall of Medicaid.
Which they did get, didn't they?
I can't answer all of
Well, I mean,
the
I know it's
helpline's
because of the
questions,
government
but
shutdown.
I know
They
that
were gonna be short.
I know that they told us that that's what they used the money for. I agree with you. I don't believe going into it. I sure didn't know that's what they were using the money for going into the budget year. But the response we got is that is what they in fact used it for. So that's where they got the coverage last year, was in that one-time money.
Where are what's the 9 days for?
Based on the funding we provided, they were cutting their days and cutting their hours.
It was to provide some additional days for the nurses to be there for when there was teacher work days to do training, because what they were only being budgeted for was the actual day the kids were in school. And the 9 extra days were to cover times when the kids weren't in school for training, is the way I understood why they wanted the extra days.
The legislature did pass a bill in the short session, if I understood it correctly, and I just glanced at it, so I'm not an expert, that school systems are going to have to provide EpiPens on site versus now, if you need an EpiPen, you bring your own. And EpiPens vary based on what you need, so I'm not real certain what they're going to be required to have on site, but that would be something that would be locked up in the nurse's office because they shouldn't be out where anybody else can get a hold of them. I've never used an EpiPen, so I wouldn't be, I mean, I've read the instructions on them, but I'm not one that really knows how to use it. So, again, it's something else that nurses do a lot of. I know that the nurses are very busy, so that's why I'm appealing to this board to provide the funding for the shortfall, so.
Well, they were gonna cut from what, 7 hours to 6? Or
I think it's 7.5 to 6.5. They were cutting an hour a day. And we had said last year that we wanted, that it was important for us to cover the nurses, and so, again, it was a mathematical error. If we had gotten the right number last year, this would be a moot point because it would have been covered. And that's why I wanted to bring it to everybody's attention. So, anybody else want to make comments? I don't know if you wanted to finish yours. I didn't mean to cut you off, Chris.
No, I just, I agree that the school nurse program is very vital, and I think they provide a good service for the students of Cabarrus County Schools, but where I'm troubled is that, we approved those one-time funds, and I remember the conversation that we all had, and we all agreed that it would be for the Medicaid shortfall, and then the money was used for the school nurse program. So it's mismanagement of funds, which, unfortunately unfortunately affects the school nurses, and that's something that we had nothing to do with. And as I said, I think it's a very important program, and I think we should keep it. But I don't like the fact that the funds that we approved for a particular, well, it wasn't a project, we designated the funds for a particular purpose, and they weren't used for that, and that very much bothers me.
And I think, if memory serves me correctly, which I don't know if it does or not, but for some reason I'm thinking that during the year we were told at some point that we didn't say if you don't use them for that you have to give the money back. So I think I would disagree with misuse, your term misuse. I think he used the funds. We gave him the funds and said to use them. This is where they were used.
Right. We gave a specific purpose for the funds, and I do recall that we were going to see how it played out. And then I was never told that the funds were going to be used for a different purpose. You may have been told, but I never was told.
I don't remember being told specifically that. I guess what I'm saying is that Larry was under the impression, and I was too, that they got some money that they weren't expecting in Medicaid. Is that what you were going towards?
I understood that, or my understanding was that if they got their funds from the federal government, that they would give the counties their funds back. Now, I might be wrong in that, but that's what I remember.
My understanding was that if they got the money, that we were letting them keep it for the year, and then we would look at it. I really don't want to debate the merits of how it was used last year. I don't want students and staff to be hurt because of a mathematical error or that was done last year. I just think we can make it right, and it's not a big deal for us.
Did they use all that funding last year for school nurses?
No.
Are you referring to the 300,000?
Yeah.
Not all of it. I can get you the breakdown on what the contract stated if you would like.
How much? Yeah, I'd like to see how much you did use for school nurses. If it's $300,000, they would have enough left to take care of this year.
And do you also want that spreadsheet that Ms. Poole has? Would you like that emailed to you also? Okay.
Yeah.
And I had just asked for this today, and so I just literally got it when I walked in, so, and had not had a chance to look at it to see what the number was. They had asked for more than that. This is just to get the nurses on campus when the students are on campus, so.
Chairman
Steve, do you want to, sorry.
Yeah, serving on the Board of Health, I've heard the discussion from both sides of the issue. My understanding was, as well, the last year, the funds that we allocated to them as one-time funds were funds that they had lost from Medicaid reimbursements as a result of the discontinuation of clinical services that they previously had provided at the Health Alliance. When a previous board of commissioners had indicated that they wanted those services discontinued, that was an income stream that they lost. So I don't think that at the time, I do not think it was a misappropriation of funds. I think that we were replacing lost income, and I don't think we actually discussed exactly how those funds would be expended other than the general expenditures in their budget. And we could have, I think we could probably have an entire special meeting to discuss how those numbers work back and forth on the budget. Irregardless of that, and I think that the question was asked, how much of that $300,000 was spent for school nurses? I think we've been given that figure a couple times, and it was either this once, I believe it was 168,000 or close. Was it?
I'll have to look it up and get it to you.
Yeah, we'll have to get it to you.
It's been bounced around quite a bit. Irregardless of all the details about, I agree with Chairman Poole that our school students should not be penalized, and that these are important services. I also read the legislation that you mentioned about the EpiPens, and that did pass. That's going to be I guess the school will have to pick up that expense, but not just everybody can use those and administer it. I, like you, have had those before and have read the directions, and fortunately have not had to use them, but that's just one issue of many. So I would very much be in favor of restoring those funds or increasing those funds so that we can fully fund that school nurse program. If you look at the counties around us, they are working hard to try to get to where we were. Instead, we're going backwards, closer to where some of them are trying to get to. So at any rate, I think we should correct that problem.
Anybody can administer an EpiPen. I mean, I went to the doctor and got one, and they gave me a prescription for one, and you take them home and you put them in your. So certainly we could have a trained principal or any number of staff at the school that's trained to administer an EpiPen. Just like we have these defibrillators that didn't most of our staff get trained on using a defibrillator. That's a hard word to say. But, I mean, the idea that we have to have school nurses paying separate staff to administer an EpiPen or to do a defibrillator when we've got all that training amongst county staff, I think that's not necessarily pertinent to this conversation. We've had several conversations with Dr. Pilkington. I think that those stretched over 2 meetings, and a budget meeting was decided this. And Chairman Poole, I do not begrudge you for bringing this back to us. I mean, I think that it's a good discussion. If you'd like to make a motion on it, I would be willing to suspend the rules so we can vote on it. But, you know, this is going on 4 months of the same conversation, and I think it's been decided. But I'm happy to take another vote on it if you'd like to. But I think we should just do it tonight. That will give some certainty to the school nurse program going forward in the schools, and you had mentioned schools getting ready to get started. So I think we should take a vote on it and give some certainty.
And the only reason I brought it up again was the reduction in hours, because I just saw that in the paper. I had not heard that from anybody else, and so I thought I didn't know that, and that's the only reason that's the only reason I asked today of Pam, and that was the only reason I brought it up. So go ahead. I'm sorry.
Was that hour going to be in the morning or in the afternoon?
You know, I have no idea. And I don't know if it'll change per school. I have no idea. I just know what was in the newspaper. It said that they were cutting them back an hour. So I don't know if that decision's been made on a site-by-site basis.
I mean, the only thing I look at is the fact that if that hour that extra hour that's needed, if it saves the life of one child, that child's life is worth more than $164,000 for one. So how many more, you know, might happen to be saved in that hour's time? And I think we ought to go back and keep them like they are. I don't mind spending $164,000. I know it's county money and county funds, county tax dollars. But for the school system and for the nurse to be there when the students are there, I think it's very important.
We have got children all over this county doing all sorts of activities that don't have a school nurse present. So this idea that if it can just save one child, it's worth it, I think that's a cop-out. If that's the case, then we ought to just go out and hire a bunch of school nurses and put them on every corner, and that way every child that goes to a park will have a school nurse accessible. Every child that goes to the bounce house, every child that goes to preschool, every child that goes to the mall will have a school nurse accessible. I mean, we have a wonderful paramedic staff. I mean, we fund our paramedic staff to an absolute top-notch level, and you know, this just seems to me like we're keeping positions in the government because we've always had them, and this is an opportunity for us to recognize that the situation has changed and to make an appropriate change to address that change in circumstances.
I thought you were leaning up, Chris.
Yeah, well, I was just going to say, you know, I had a discussion with the school nurse recently, and she told me how frustrating the job is that, you know, there's basically nothing she can do. She said that she has children that come into her office with a high fever, and, can't get in touch with the parents, and that she can't do anything, and that her hands are tied. And she said the job is very frustrating, that, you know, they don't have the flexibility to do their job. And, yeah, that's what really aggravates me. As I said, I think it's a great program, but, you know, whenever they can't do their own job because of regulations and, you know, as I said, the majority of the students that go, as I was told, that they can't get in touch with the parents, and they end up having to go to the emergency room. So, you know, as I said, I think it's a great program the way it's designed, but, you know, going back to last year whenever we appropriated the one-time funds, that, you know, the way I felt that we were not told the truth really aggravates me.
You said that you would make a motion to suspend the rules.
Sure.
Will you do that?
I make a motion to suspend the rules so that we can vote on your proposal.
Address school nurses.
Address school
We'll
nurses.
put it that way. Okay. There is a motion. Is there a second?
Second.
There's a motion and there's a second. Is there any other discussion? Okay, all the, suspending the rules. All those in favor of suspending the rules, say aye. Aye. Any opposed? Okay. Since I brought the issue up, I will make a motion that we provide $164,905, is that the right number? Because I gave you that, okay. For the school nurse program to be used, for school nurses to have their hours at 7.5 hours a day and the additional 9 work days, right? That's what that number represents. Okay, just want to make sure I got it right. So I will make that motion. Is there a second to that motion?
What happens when students are there after hours? They depend
Usually
on
when
emergency
students,
services, right?
well, not all the time, but students that are there after hours, if they're involved with athletics, there's an athletic trainer that's there. There's usually 1 or 2, depends. I can't tell you about elementary and middle as well as I can high school, but high schools will have an athletic trainer that's required to be there whenever there's the athletic practice and events are going on. That's probably when you have the higher incident of injury, at least, after school.
Madam Chairman, I'd also say that, I mean, it sounds like one of the major factors going into this is these 9 additional days when children aren't even going to be there. This is paying paying student nurses to be at schools where there are no children. So this is not going to be about saving one additional life. This is just about giving them this complete schedule because they've always had a complete schedule. And so, I mean, it's not about the children. It's about the government, and it's regularly about the government.
What is the cost just to go the extra hour and not do the 9 days?
I have no idea. I don't think they broke it out for us.
The 9 days are in addition. They're not currently operating with the additional 9 days.
They were last year.
They were, okay.
They had been less hours and less days. And last year, we tried to make it right and give them enough hours so they were there when the students were there.
And so we didn't give an increase in funds whenever we decided to?
We thought we were covering it. There was a mathematical error. She pulled up the wrong number. That's all it amounts to. We would have done it last year if we had had the right number, and we would not have discussed this again.
Okay.
It was a mathematical clerical error in giving the county the right number to fund, because that's what we said last year we were going to do.
But as the point was made earlier, they have operated for a year with, currently without these funds. So.
No, they took them out of 300,000.
Well, somehow they operated.
Isn't that correct? They took them out of $300,000?
Yes, sir. That's my understanding.
But how much is the $300,000 they have left over now? Could they not fund this?
They didn't get that money again in this year's budget.
Whenever they discovered that there was a mathematical error, and throughout the year they're having to spend these $300,000 funds that we appropriated for a particular item, why were we not told? Why did they not come back and say, oh, there was a mathematical error, we we wanted the 9 additional, or you guys appropriated money for the 9 additional days, 1 extra hour, but we gave you the wrong number instead of getting all the way through the year, using the funds that we had appropriated for a different purpose, and then now coming to say something. It seems like that would have been brought to us at some point during the year.
I don't think there's anybody here that can answer that
That was
question.
discovered during the 2015 budget process is when we found out that there wasn't enough money there. We were trying to reconcile what we had been funding versus what they had been paying. That's when that differential came up, because there wasn't enough funding there.
Right. And I'm not saying that it's something that you should have called on your behalf. I'm
Well,
saying
C. Yates and I called it when we were sitting down, and she was a new finance director, and I was working with her, and that's when we discovered that this money was not working out, and we had gone through and found everything else, and we pulled up those old schedules and saw where the numbers were picked up in the wrong place.
The finance director, whether it was the old, or I guess it would have been the old one, should have realized this sometime throughout the year. I mean, to go a whole year and not realize that they had been shorted 160, or supposedly shorted 160,000, but then continue the program and somehow pay for it. I just don't understand. So that's where I essentially see this money going into a program that's already sustained itself for over a year. And so it's just contributing more money, as I said, to a program that's already been sustained for over a year.
And I think on the back of Chris's comment, you know, when we had the outbreak of, it was E. coli at the pizza place, you know, they were in here a month and a half later saying, we need this additional $22,000. So at some point, an affirmative decision was made to transfer this $300,000, if this is what really happened, to transfer the $300,000 from the purpose for which we funded it over to this purpose for which it was not funded. And so I think I share some skepticism with Commissioner Meismer. They clearly know how to come in and ask for additional money if they feel like that are entitled to additional money, that we owe them additional money, and they did not do that. So I have some skepticism of that funding issue also.
Any other comments, and we'll go ahead
Well,
and vote. And see where we
Madam
go.
Chairman, I will second your motion, and point out that I think the Health Alliance came back and asked for additional funding for the salmonella outbreak as a result of the exposure after we instructed them to do that. I think they were attempting to recover those funds on their own, and also to absorb that as one of their expenses until we told them we would like for them to come back to us and request some assistance on that. So I'm very much in favor of this. I think the extra hours to cover it are important, and I think that those training days are important as well.
Okay. I didn't intend for us to go this long. I was just trying to help out a situation. So if there's, yes? Yeah, well.
The 164,
yes.
Your funding source would be your board contingency?
Yes,
That's
that
right.
would be part of my motion.
Okay.
Sorry.
The only problem I have is the fact that he sat here and told us that 49% of his budget went to illegals. Don't know what he said?
I don't remember what the exact percentage.
I'm pretty sure it's 49%. And I don't know what his budget is total. But, you know, some point in time, well, we're gonna bankrupt the system anyway, so. But I'd like to, I can't vote for it tonight, but I'd like to see what they got left out of that $300,000, how much of that they could put into it.
Hey, well, we have a motion and a second to approve the funding tonight. All those in favor say aye. Aye.
Aye.
All those opposed?
Aye.
Okay, motion does not carry. I'm sorry. Next, we have the regular meeting agenda. If you'll look at that, please. Let's see. Under consent, 3 and 4, as part of approving this agenda, we're going to move 3 and 4 to the September work session, right? Is there anything else?
We need to add number 10, the park.
Oh, okay, we're going to add,
Discussion to new business.
right, new business, your 4.11 it was, but
Yeah.
it'll be, the park ordinance will become number 1 under new business. Okay.
Madam
Thank
Chairman,
you.
is there any reason item number F2 needs to stay on our agenda? Is that anything that we consent to?
Do you want to move it to the work session so that you have more time for feedback on the goals, or what's your thinking on that one?
Well, it's on the consent agenda, so we wouldn't have an opportunity to have any discussion about it anyway. If we were going to talk about it, I suppose it would need to be a new business, but I don't even know that's something
Do
we
you
need
want
to
to do
talk
it in new
about.
business, or you just want to put it on the September work session and approve it at the work session?
I think the September work session would
Okay.
be fine with me.
So, thank you. So 2, 3, and 4 would move to the September work. I think that's more appropriate at the work session to have that general discussion. So 2, 3, and 4, under consent, would move to the September work session. And again, we would add the park ordinance under new business number 1. Is there anything else? Okay, if not, I would accept a motion to approve the regular meeting agenda with those changes. Do I have such a motion? Have a motion, do I have a second? Motion second, all those in favor say aye. Aye. Any opposed? Okay, may I have a motion to adjourn? A motion and a second. All those in favor say aye. Aye. Any opposed? Okay, thank you all very much.